Hello everyone, I am Dr. Mahalakshmi, educator, forensic medicine and toxicology. In this video, we are going to see about firearm injuries. This is very important and interesting aspect of forensics. This may be confusing for a lot, but if it is read properly, then it is a very simple topic. Once you are ready with this, you will never forget it. So, we will start with this firearm injuries. So, this firearm, we call it as forensic ballistic. Forensic ballistics. And this ballistics, we have three types. First is your proximal ballistics, intermediate ballistics, and finally terminal ballistics. So, we get three types of ballistics. So, what this proximal ballistics is that when the bullet, it starts from the barrel and it exits the barrel, okay. It will start from here. When you put the trigger, you will pull the trigger, then the firing will happen and this bullet will travel through this barrel, right. So, this part till it exits the gun. So, from trigger pulling to exiting of bullet. This is dealt in proximal ballistics. When the gun is pulled, the bullet exiting out of the barrel, we have this proximal ballistics. And this bullet, while it travels in the air, this part till it hits the target, this part, it is intermediate ballistics. And finally, what happens once it hits the target? What happens once it hits the target? That is given by terminal ballistics. You have three: proximal, intermediate and terminal ballistics. Proximal from pulling of trigger till the bullet get exited from the gun. So, only what happens inside the gun we will deal. Intermediate ballistics, when it got exited from the gun till it hits the target, what happens in the air? That is intermediate ballistics. Finally, terminal ballistics, once the bullet hits the target, what happens in the target? That is terminal ballistics. Now, our area of concern is this terminal ballistics only. We will be reading terminal ballistics. What happens in the target is our only point of concern. So, this is what forensic ballistics all about. So, this is the definition. This is what we are going to see now. So, clear? What is the proximal ballistics, what is the intermediate ballistic and what is the terminal ballistic? Done. Now, what we are going to see is part of the firearm. We will have an idea on the parts of the firearm. So, first what you have is this stock, then you have the lock, then you have the barrel. You have three parts. Broadly, we have classified all the parts under these three: stock, lock, barrel. So, stock consists of the non-moving parts. So, you have the non-moving parts of the gun, like your this handle, everything that comes under the non-moving part will be considered stock. And lock is the moving part that is inside the gun. Your trigger, firing pin, that bolt, everything will be coming under this lock. Stock is fixed, lock is moving parts. And finally, barrel. This is the pipe through which the bullet travels. So, this is the barrel. You have stock which is non-moving, lock which is moving and the barrel. So, this is divided into three. So, what is present in each and every one we will see. How the gun actually works, we will have an idea. Now, just look at this picture. These are the complete parts that you can see in a pistol, which is a normal gun. So, this is the grip. This area, this is the grip. And this is the magazine. You have a small box. Inside this, you can see the bullets. So, this is your magazine. Magazine means it is a small box that holds all your bullets. And next what you have is trigger. This is what you pull when you want to shoot somebody. This is the trigger that you will use to pull, and this is the trigger guard. This will prevent the trigger from getting pulled accidentally. So this is trigger guard, and this we have already seen. This is the barrel, and this area, this opening here, this is muzzle. This is known as muzzle. That opening is known as muzzle. And this one, this is known as hammer, and you have the firing pin. Like when you cut open, you will be able to see this firing pin, and you have the bullet covered by the cartridge. Like we will see about bullet later, but now just know that there will be bullets here. So what will happen is that when you pull this trigger, when this trigger is pulled, like inside there will be one bolt action. Because of that, hammer will get activated. So when you pull the trigger, the hammer will be pulled down, and this will go and hit this firing pin. This will go and hit the firing pin. This firing pin in turn move forward. So this firing pin will move forward, and it will go hit the cartridge. In the cartridge you will have something known as primer. That primer, it will ignite instantaneously. When there is a small mechanical action, it will get fired instantaneously, and that fire, it will push the bullet out of the barrel. So you will get the bullet coming out because of the ignition of this primer. So basically what happens, you will pull the trigger. This will activate the hammer. This hammer, it will go hit the firing pin. This firing pin will move forward and go hit the cartridge. That cartridge will have primer at its base. So that primer, it will get ignited by this firing pin's action. Once this primer get ignited, it will push the bullet out of the barrel. So this is how the gun works. All the guns, this is how the firing happens. Clear? So how the gun works? Trigger, hammer, firing pin, primer, then the bullet goes out. This is the happening behind firing mechanism. Now we have to know one more thing in this part, that is the barrel. So this is the barrel, right? And inside of the barrel, here do you see there are a lot of markings, right? This marking is known as rifling. And here if you see, there won't be any mark. This is a smooth region. So based upon this, we have divided the gun into rifle and smooth bore gun. Okay, so the gun, it is basically divided depending upon the marking inside the barrel. If there is rifling, it is known as rifle. If it is smooth, it is known as smooth bore gun. So example for smooth bore gun is your shotgun. The big gun that you see in all the hunting and all, that big gun with big cartridge, that is your shotgun. And for rifle, most of the example like your pistol, your AK-47, all the guns that you see will come under this rifle. All the automatic, semi-automatic guns, everything will be coming under this rifle. Pistol, revolver, all the normal guns that you see, it is coming under this rifle mechanism only. So this is about the initial introduction of the parts of the gun and the classification of the gun. Now we will see more about the mechanism behind this firing and all. So first we have the smooth bore firearm. In the smooth bore firearm, how you define it? Like we have something known as bore. So what happens is that there are multiple sizes with which this gun will come. So how do you define the gun? Based upon this bore, you will define the size of the gun. So size of the gun, it is first defined in smooth bore by bore. So bore is the number of equal size spherical ball made from 1 pound of lead which exactly fits inside the barrel. So basically you measure the diameter of the barrel, and that barrel diameter, it is measured, not just simply you will use the lead balls to measure it. How many balls that you are able to accommodate inside that barrel, using that you divide the smooth bore gun into multiple types. So you will have a small barrel, and that barrel will have one name. and the big barrel it will have one name. Like that, multiple division inside the shotgun or smoothbore firearm will be done using this bore mechanism. And the counterpart of bore in case of rifle firearm is gauge. So the gauge or caliber is this. You have rifling like this. So inside the barrel you have these grooves and you have the land. So like groove is this depression. Groove is depression and land is elevation. Clear? So you have alternate land and groove. Land and groove, like that the inside of the rifle will be seen. Now what you have to do is, you have to measure the distance between two opposite lands. Between two opposite lands you have to measure the distance. That distance it is known as caliber, and by measuring this caliber you will divide the rifle. You will say it was a 0.2 caliber, 0.5 caliber, like that we will be saying. So that caliber is nothing but the distance between two opposite lands. This is how you classify the rifle firearms. For smoothbore it was bore. Here in rifle it is this caliber. Clear? So basically it is rifle and smoothbore, and inside the rifle and smoothbore we further divide them based upon the diameter of the barrel, and the term that we use to describe the diameter is bore in case of shotgun or this caliber in case of rifle. Clear? This is about this caliber and bore. Now we have one more thing known as choking. So choking, this is seen only in smoothbore firearm. That is your shotgun. It is seen only in the shotgun. So what is this choking? So normally this is how the barrel will be. So you have the straight parallel barrel like this. But what happens is that in shotgun you will have these constriction like a neck. You will have these constriction which is known as choking. So choking is nothing but constriction of barrel diameter towards the end. So this is known as choking, and this choking it is done to increase the speed. To increase the speed we will do this choking, and this choking is done only in case of shotgun. If they ask you where choking is seen, it is seen only in shotgun. It is not seen in rifling. Choking is constriction of the barrel's diameter towards the end to increase the velocity, to increase the speed. So this is choking. Now we will go to the ammunition, that is the bullet. So ammunition is something that you use to fire, right? So we will go to that. In smoothbore firearm we have the casing and cartridge. And in case of rifle firearm we have the bullet. So what happens here is that this is your bullet cartridge. So every ammunition it have this cartridge cover, and this is that cartridge. So it will be a metal jacket. So you have a metallic cartridge covering your ammunition, and inside that cross section of it you have the primer. So at the base you have the primer. This is where the firing pin will come and hit. So this is where the firing pin will come and hit. This is your primer, and after the primer you have something known as gunpowder. So all this area you will have gunpowder. So what happens when the firing pin hits this primer? This primer it will be very easily ignited, and when this ignites it will go ignite the gunpowder. So we have lot of gunpowder kept over here, and this gunpowder will ignite, and because of this ignition there will be gas production. When something burns there will be production of gas, right? So all the gases it will accumulate here. everything will accumulate here, and because of this extreme pressure, this will push the bullet out. It will push bullet out. So that is how it happens. So the pin will come hit the primer, which will ignite very easily, and this in turn will ignite the gunpowder, and this gunpowder ignition will lead to gas production, and that gas will push the bullet out. So cartridge, it will go down, only the bullet will travel far. So this your casing, outer casing, it will come down, and this bullet, this part, this will travel far and it will go hit the target. So in rifle, you have the cartridge as the ammunition. In that you have the bullet as the projectile. Clear? The ammunition is cartridge and the projectile is bullet. How this happens? When you pull the trigger, this will cause the firing pin to come and hit the primer. So primer will ignite and it will in turn ignite the gunpowder, and the gunpowder will lead to lot of production of gas, and that gas will push the bullet out. The bullet is the projectile. This is how it happens in the rifle. Now, in case of shotgun, that is your smooth bore firearm, what happens is that you will have these cartridge, along with that you will have these pellet. Okay, this is known as pellet. You will have something known as pellet. You will have the small beads. This is the projectile in case of your shotgun, and this bullet, this is the projectile in case of your rifle gun. So what happens here is that you have the outer case covering, you have the outer case, and just like that you have the primer at the base, and above that you will have the gunpowder, and you have one more thing known as wad here. So wad is nothing but a small obstruction. Okay, it is usually made of plastic or clothing, something. You will have a small object just used for obstruction. This whole area, it will be wadded, and above the wadder you have the pellet. Above the wadder you have the pellet, small round pellet you will be seeing, and everything is closed by this outer cartridge cover. So this is the part of a shotgun bullet. So you have the rifle which had this metal casing, everything. Here you had the outside cartridge with the wadding and pellets. So projectile for that rifle is bullet, projectile for the shotgun is pellet, and wad is present only in shotgun. This is the ammunition for both rifle and shotgun. Now we have something known as obturation. Say, why this wad is there? This is to provide this obturation. So what happens is that you have the bullet in rifle firearm. So because of the combustion of the gunpowder, you will have gas, right? So this gas, this will go uniformly push the bullet outside. There will be uniform pressure that will be pushing the bullet out. But in case of pellet, it will be small pellet, right? There will not be any uniform pressure. So there will not be any uniform pressure, and in between this the air can escape. The gas will escape. So to prevent this from happening, we use wad. So this wad is simply a card disc. So above the gunpowder, this is where the gunpowder will be. So here you will have the gunpowder. This will ignite and produce all the gases, and it will push the wad, and the wad will push the pellets outside, so that no gas escapes from this wad. So this is the reason for putting wad only in shotgun. This is to give obturation. This is to give an impedance, to give an obstruction. So this is the mechanism behind putting wad in the shotgun projectile. Clear? Now we have to know what is the composition of this primer and what is the composition of this gunpowder. Both are completely different. Primer, it will easily ignite, and the component consists of this barium nitrate, lead peroxide and stiffenate, antimony sulfide and tetraacin. This can be asked. You can remember by this mnemonic BLAST. Barium nitrate, lead peroxide and stiffenate, antimony sulfide and tetraacene. This is primer's composition. Now you have gunpowder. Gunpowder composition is if it is a single base, it consists only of nitrocellulose. If it is double base, it has both nitrocellulose and nitroglycerin. If it is double base, it has both nitrocellulose and nitroglycerin. If it is triple base, it has nitrocellulose, nitroglycerin and nitroguanidine. So, this is the composition of gunpowder. Primer, it is different from gunpowder. Gunpowder you have 3 bases, single, double and triple. So, what is the component here? Nitrocellulose, nitroglycerin and nitroguanidine. Clear? This is also an important question. They will ask you what is the composition of primer, what is the composition of gunpowder. Now, projectile we already saw. This is for rifle, you have the bullet, and this is for shotgun, you have the pellet. Clear? Projectile, ammunition we have seen till now. Now, we will be seeing types of bullet. So, this is known as mushroom bullet or dum-dum bullet. So, this bullet, this will look like this. This is soft nosed. This nose, this region, it will be soft. So, on hitting the target, on hitting, this will open up like a flower. Okay. So, like a flower, it will open up like this. So, it will mushroom. That is why it is known as mushroom bullet and dum-dum bullet. This is mainly used to cause severe damage to the target. And this is what used by the British in India. So, this dum-dum bullet, also known as mushroom bullet, it usually has this soft nose which will open on hitting the target. So, this is one type of bullet. Next, what we have this is known as incendiary bullet. This bullet, this will cause fire on hitting. And next you have is this disappearing bullet. Like when it hits the target on hitting, it will fragment. It will go into multiple pieces so that you won't get anything. You won't be able to find a bullet, so that the confusion will happen. No one will be able to identify the shooter. So, this is known as disappearing bullet. And this one, this is known as tracer bullet. You will be able to trace the pathway of the projectile, like where it go, you will be able to trace it. So, these are the different types of bullet that you commonly come across. Next, you have these unjacketed lead bullet. There will not be proper metal jacket. The nose will be completely open. Sometimes you will have the fully covered or partially covered. So, like that also you will be getting. So, like this also you will be getting the bullet. And here I told you, right, depending upon the bore, the size of the diameter, you will have different. You have bird shot, you have buckshot, you have big buckshot, and you have this slug. So, depending upon the size of the pellet, you will differentiate the shotgun. So, these are the different types of bullet and pellets. Now, we will look at something known as primary marking and secondary marking. So, what is primary marking and what is secondary marking? So, whenever a bullet comes out, like when freshly prepared, it will look like this. There will be no marking. It will be completely clear. But when it goes along the barrel, because of the pressure and the velocity, that barrel's impression will be seen over the bullet. So, the barrel's impression will be seen over the bullet. This is known as primary marking. And this primary marking, it is specific to each model. Like a single model gun, like if there are 100 guns in that same model, every model will have the same primary marking. So by comparing this primary marking, you will be able to identify the model of the gun. So primary marking will give you model of the gun. Like you will be able to identify whether it is an iPhone 13 or iPhone 14. Like that you will be able to identify that model, you will be able to identify. Now we have something known as secondary marking. So this is secondary marking. So what happens is that once you start using the gun, you will be doing normal maintenance. So this barrel, it will be filled with grease and there will be lot of wear and tear. So to remove all those wear and tear, you will use this machine to clean the barrel. Because of that, the barrels inside will get some modifications. So this is a metal, you will push it inside the barrel and you will clean it, and this metal, it will cause some scratches inside the barrel, right? So these barrel also, like these scratches inside the barrel, this will also lead to some changes in the bullet covering, and those covering we call it as secondary marking. So the secondary marking is specific to each and every gun, and this can be seen only in comparison microscopy. So what will happen is that you will get one bullet from the crime scene. So you will have that bullet and you would have zeroed into some suspect. You will have some 4 or 5 people, amongst one of them has to be the killer. So now what you will do is, you will collect all the guns. From each and every one you will take the gun and you will ask them to fire a bullet and you will take bullet from the gun. Now you will compare the bullet from crime scene and the bullet you have taken from your suspect. Under this, like this, you will be seeing. If both the markings, the secondary markings, if both is matching, then that means both the bullet came out of a single gun. So by identifying this, you will be able to identify the gun and the gun's owner will be the usual suspect. So this is how the secondary marking will help in identifying the single gun. So you have already identified whether it is a iPhone 13 or iPhone 14. Now with the secondary marking, you will be able to identify whose phone is that, whose property is that, you will be able to identify. This is the importance of primary marking and secondary marking. Primary marking can be easily seen in naked eye. Secondary marking, you have to use this comparative microscopy, and through this microscopy, you will be able to identify the exact gun. First, you are able to identify only the model. Now, you will be able to identify the same exact gun that was used to fire. So, this is the importance of this primary marking and secondary marking, and together finding these two is known as bullet fingerprinting. This is known as bullet fingerprinting. Clear? So, this is about firearm. Now, what we are going to see is this motion of the bullet. Sometimes, like usually it goes straight, but sometimes what it will do is, it will go sideways. So, this motion is known as yawing. So, yaw is sideways motion. Sometimes it will go up and down, like this, up and down. This is known as pitch. Like a ball, it will pitch down and go up. This is pitching. Then you have tumbling, it will completely rotate, okay. This will undergo complete rotation. This is known as tumbling. Why we are seeing this is that depending upon the motion that it goes, the wound will be different. Sometimes you will be finding the bullet like this, like it will be going out. So this is the body and the bullet will be trying to come out of the body. So you will naturally think someone has shot from behind. If they had shot from in front, the bullet should be going out through the back, right? But this bullet, because of this differential motion, it will seem like it is going out, but actually when he was shot from front. So by find out the relative position of the victim and the attacker, we have to know about all these differential movements. So yawing is sideways, pitching is going up and down, and the tumbling is complete rotation of the bullet. Now there is something known as piggyback bullet. Piggyback bullet. So, in this what will happen? In a single strike, like you will have the single strike, but you get 2 bullets coming out. So, like this, because of a faulty gun, you will have 2 bullets coming out in a single strike. So, if you find 2 bullets, you will think maybe 2 shots have been fired, but normally it would have been only 1 shot, but because of the faulty mechanism, you got 2 bullets. So, like that there will be lot of confusion while doing the autopsy. So, to avoid those confusion, we have to make sure about knowing all these faulty techniques in the firearms. Next is this. This is something known as snowball effect. So, here what happens is that whenever a shotgun is fired, normally the pellet will come together up to certain distance. After some time it will start to separate. So, there will be separation of pellets beyond certain distance, and when it go hit the final target, like it will be seen all over like this, all over the body the pellet will separate and each and every pellet will go hit the target separately. This is how it usually happens. So, after a specific distance it will go and split. But what will happen here is that like something will be standing between the gun and the target. So, this will go hit the target, this intermediate target first, and because of that there will be different spreading. Okay, it should have spreaded like this, but since it hit this target, this will only spread up to this distance. So, by looking at the final target, you will not be able to find out the range. There will be some confusion in range calculation. So, this phenomenon is known as snowball effect. Like in snowballing, like in pooling, how one ball go hit and disperse all the ball, like that it will happen. So, it will go hit an intermediate target, and because of that the splitting will happen and you will not be able to identify the range. So, you just remember snowball effect happens in shotgun. It will confuse in the calculation of the range. So, snowball effect seen in shotgun, that much we need to remember. Now, going to the topic proper, that is terminal ballistics. What happens in the target? This is what we are going to see now. So, whenever the bullet come and hit the target, in the entry wound, you have one entry wound, you will have one exit wound, right? In the entry, you will be getting to see certain things. So, first is your abrasion collar. Next is your grease collar, and you have your contusion collar. So, these are the 3 things that you will be seeing in a entry wound. So, how this happens is that, so whenever a bullet come and hit you, you will get a central hole, you will get this wound. Around that wound, you will get something known as grease collar. So, this is grease collar. This is caused by the grease that is attached to the body of the bullet. That bullet, it will wipe all its grease along your body. That is known as grease collar. And once the bullet hits your skin, because of the mechanical trauma, there will be abrasion and contusion along the border. So, you will be seeing abrasion, and beyond that you will be seeing contusion. So, you have your contusion and you have your abrasion collar. So, if you go from inside to outside, you will first get grease collar, then you have your abrasion collar, then you have your contusion collar. So, C-G-A-C. This is how it will be. The order will be like this. So, if you find this in a body, then it has to be a entry wound, and this grease collar, it has few other names known as bullet wipe, bullet soiling, dirt collar, grease collar, all the other names for this grease collar. And after grease collar, you will find abrasion collar, and after that you will be finding contusion collar. So here this is your wound and this black dark region is your bullet wipe, and you have the abrasion, like this area is the abrasion and this thing is the contusion. This is how you will be finding the firearm injury. So entry wound, you will be seeing this 3 collars. So here you can see this is the abrasion, this is the contusion, and this dark here is the grease collar, and this is your wound. So this is how it will look like, and something known as atypical abrasion collar. So this atypical abrasion collar, like only one side you will be seeing abrasion, other side you will not be able to see. So those kind of atypical abrasion collar will also be seen, but this is the abrasion that you have to know. Now apart from this collars, you will be getting to see few other things in the entry wound. Those are this burning, and there is blackening, and there is something known as tattooing. So when a bullet comes out of the gun, along with that there will be flame, smoke and unburnt gunpowder coming out. This flame, it will lead to burning and singeing. If there is cloth or hair present, it will burn. If the smoking, it will lead to black. The smoke that is coming out of that will lead to black discoloration, and the unburnt gunpowder, it will go hit your skin and it will impinge in your skin. So that is known as tattooing. These all 3 things will be seen in the entry wound depending upon the distance, because this flame, it will travel to a short distance only. The smoke, it will travel a bit farther than this flame, and this tattoo, this unburnt gunpowder, this will go a longer way than this smoke and the flame. And bullet, it will head for a really longer distance than all these 3. So depending upon these 3, you will be able to find out the range of the gunshot injury. So this is your blackening. This is blackening. This is singeing or burning. This is your burning. Here you can see blackening also, and this here, this is singeing or burning. And this small dots here you are seeing, this is tattooing. This is tattooing. This is how it will look like. Here you can see very clearly all these small dots. This is your tattooing, and based on this tattooing, this will go unburnt gunpowder, this will go into the dermis, but these smoke particles, burnt powder, this will go only up to the epidermis. So if you want to know whether it is blackening or tattooing, you can simply wash it. If it can be washed away, then it is burnt gunpowder, smoke and blackening. If it is not washed away, it is unburnt gunpowder, that is your tattooing. So this is how you identify these 3. And based on this, how will you identify the range is that if you see burning, blackening, then tattooing, all 3 are present, then it is a near or short range. If you don't see burn but you see blackening and tattooing, then it is intermediate. If you don't see both, see only tattoo, then also it is intermediate. If you don't see any of this, then it is long or distant. So this is how you identify the range. All 3 are present, then it is a short range or near range. Like only blackening and tattooing present, then it is intermediate. All 3 are absent, it is long or distant. So this is how you identify the range of these guns. Now, like this about the near range, what about the close contact? In case of close contact wound, you will be seeing this stellate shaped wound. Stellate shaped wound. So what happens when the gun is pressed against the skin and fired? Like all the gas, all the bullet gas, everything will go into the skin and it will try to come out, and there will not be enough space for the gas to come out. So it will pierce the skin and it will come out, and because of this piercing you will get this stellate shaped wound. And apart from that, you will also get this muzzle impression. This is known as muzzle. See, muzzle is the front part of the gun, right? So you will be seeing the abrasion which will look like the muzzle. So this muzzle impression is also seen in contact wound. So contact wound, you will see the stellate shape, and this muzzle impression, and if it is near, you will see all three. Intermediate, you will see blackening, tattooing. If all three are absent, then it has to be a distant range. This is how you identify in case of rifle. So, this if you see, here you are seeing only tattooing, no blackening or singeing, then it has to be a intermediate range. So, it should be a intermediate range. Now, in bones, what will happen is that you will get something known as beveling. So, here do you see this scraping of the bone? See, this is known as beveling. This is what happens when bullet hits the bone. And if you see this beveling on the inner table, okay, inner table beveling is present, then it is an entry wound. If inner table is not beveled, outer table is beveled. Okay, outer table beveling is present, then it is a exit wound. So, here if you see this beveling, it is seen in the inner table, then it is a entry wound. Going in, it is entering in, so it will be seen in inner table. And here inner table is free, only outer table is showing beveling. This is an exit wound. So, like this you will be able to identify in the bone which is entry, which is exit. You can identify using this, because there you will not be able to identify abrasion collar or contusion collar. There is no skin, right? So, only bone will be there. In the bone you can identify which is entry, which is exit by looking at the beveling of the bone. And for shotgun, this is how you will identify the range. So, shotgun, if it is nearby, it will form a single hole. As the distance increases, it will become separate pellets and it will cause separate holes in the body. And by using this, we can identify range of the shotgun. And this shotgun in distant range, you can see multiple pellet holes, right? So, this is a distant range, and these are the VATs. Sometimes this VATs will also go hit and this will also lead to injury. So, these are the pellet, these are the VATs, everything can be taken away from the body. That is how this shotgun injury will look. So, shotgun multiple pellet will be seen. So, this is about the terminal ballistic and finding out the range of the gun. So, finally, you have the differences between entry wound and exit wound. So, entry wound, it will be smaller, exit wound will be larger. Edges will be inverted here, while there it will be everted because it is coming out. And burning, blackening, it is seen, here it is never seen. And all the collars will be present here, but here it will be absent. Bleeding will be less here and here will be more. Protrusion of fat will be seen in exit wound, and wound track will show this cherry red color because of the gases, carbon monoxide, you will get the cherry red, but exit wound you won't find anything. And fibers will be turned in, here it will be turned out. And radiological examination will give us some clue like some bullet materials, jacket is present there or not, we can use this to identify whether it is an entry wound or a exit wound. So, looking at this, you can identify this is an entry wound, all the collars is seen, and this is an exit wound, it is everted. So, this is an exit wound. So, this is how differentiate entry wound and exit wound in the autopsy. And there is one condition, something known as short exit wound. Here you will be finding abrasion collar around the exit wound. This is known as shore exit. Normally it is not seen, but in few conditions you will be seeing abrasion collar in the exit wound. So, what is that condition is that when the exit is this along the exit, this place, if it is having support, like a person is lying along the ground and somebody is killing. So, when the bullet tries to exit over the back, it will go hit the ground, right? So, there will be bullet, ground, and the skin in between these two will get affected. So, there you can get some abrasion. So, under these conditions, you will get abrasion collar along the exit wound. So, this is the short exit wound. This is seen very rarely, and when this is seen, you will be seeing abrasion collar even in the exit wound. And there are certain phenomena that we have to see in case of firearm. The phenomena that we have to know in case of gunshot injury, first, Rayalaseema phenomenon. So, here what will happen? They will stab and they will put bullet inside the stab to confuse. They will stab and they will put bullet. So people will think it was due to gunshot injury when it was actually a stab injury. So this is known as Rayalaseema phenomenon. Next you have Kennedy phenomenon. So Kennedy phenomenon, here what happens is that there will be surgical alteration of wounds, gunshot wounds. So surgically there will be some alteration because of the treatment and all, it will be surgically altered. So you will not be able to identify which is an entry wound, which is an exit wound. You will not be able to identify the range. So all the confusion will be created. That is known as Kennedy phenomenon. Because this was done to the President Kennedy. He was shot, right? So during that autopsy, because of the previous surgical alteration, they were not able to find out the proper range. So that is why this phenomenon is known as Kennedy phenomenon. Now you have something known as ricochet. So generally, the bullet should go directly hit the target. But sometimes what it will happen is that it will go hit an intervening object, then it will come to the target. So you have one entry and two wound. You will have one injury here, injury number 1, injury number 1 here and injury number 2 here. So you will think two injuries at two different paths, something else must have happened, like that you will have some confusion. So this will be the entrance. You will have effect over here and here also. So this is ricochet phenomenon. Next you have something known as Puppy's rule. So Puppy's rule is to identify the sequence of skull fracture. This is used for all skull fracture, not just firearm injury, even blunt force trauma also you can use. So what happens here is that when a fracture happens, so if the fracture line is starting from here, it will go like this. This is fracture number 1. So another fracture, it will start from here. So it will also go like this, but when it meets the fracture number 1, it will stop. It will not cross the fracture number 1. And the third fracture, if it is happening here, it will go travel like this, and when it meets fracture number 2, it will stop there. So if the fracture is already there, like once already fracture line is there, the next fracture line will not cross it. So this is the Puppy's rule. So by looking at that, you can see if this is going longer, then it should have come first. If it is going longer, then it should have come first. Like that you will be able to identify which fracture came first and which fracture came second. So this is the Puppy's rule, and this is used to identify the sequence of the skull fracture. It is used not just for firearm, for all the cases we will be using this. And whenever you do autopsy for a firearm injury, the first and foremost thing you have to do is radiology. You have to do X-ray to know whether bullet is inside or not and where the bullet is there. So it is a small object, right? You can't go, like if it is seen in the abdomen, you have to open abdomen all over and you have to find out where it is. So if you have a X-ray picture, then you can know where it is. So that area you can dissect and you will be able to identify much. So X-ray is must. Then clothing examination is must, because you can see the blackening and burning in the clothing only. So this clothing examination is must. And crime scene correlation is very, very important with firearm. And injury description is also very important, whether it is entry or exit and what is the range. Everything is very important. And one more thing that you have to know is whenever you come across a bullet, you have to take bullet only using a rubber forceps. Why? Because if you use a normal forceps, tooth forceps, and if you take it, there will be some mark in the bullet that will hinder the secondary marking and primary marking identification. So to prevent that, you have to use only rubber tip forceps, or you can use your hand. That is how you should take a bullet and send it for analysis. And you can also test for gunpowder residue. If it is usually a suicide, the gunpowder will be seen over the hand. So this is the most common region where you can find the gunpowder. If it is not externally visible, You can do all these tests: dermal nitrate test, Harrison-Guillory test, flameless atomic absorption spectrometry, neutron activation analysis, and the SEM EDXA. All these tests can be done to identify the gun residue in the hand. So, in autopsy, the main thing you have to remember: do X-ray, do proper clothing examination, do crime scene analysis, identify the entry and exit, identify the range. Then whenever you come across a bullet, use a rubber tip bullet forceps to take the bullet and look for any gunpowder residue. This is you have to do in autopsy. So, firearm, what all we have seen? What is the terminal ballistics? How the gun fires? What are the parts of the gun? What are the part of the bullet? And what is the composition of the primer? What is the composition of the gunpowder? And what are the certain phenomena that you will be seeing in the gunshot injury? How entry wound looks, how exit wound looks, how you identify the range, everything we have seen in this firearm injury, and it is very important. Sometimes you will be getting MCQs from this topic. So, this is all about firearm injuries. Thank you for watching.